Reverend Bevan, MP for ITV Wales for more than 30 years and architect of the National Health Service. His vision was free care for all, and no doubt he'd be delighted that more than 6 decades on, prescriptions are still free in his homeland. Here in Wales, health service provision is at the heart of the Assembly's agenda. It's by far the biggest financial commitment, at more than £6 billion a year. But as the election campaign gathers pace, the question is, can we afford it? Later, I'll have the results of our Wales 1000 poll on the future of prescription charges. But first, I've been speaking to patients and practitioners about their hopes and fears for the NHS in Wales.
This service is an ongoing service. As long as you need it, and you know, it's there. And if they take that away, where will we begin?
We need to have more patient power. We rely too much on politicians actually making decisions for patients.
You know, there are votes in mental health. If you've got a good message, a real concrete message for people with a mental illness, they'll listen. They're quite likely to vote for you as well if you've got something positive to say.
I'm spending the day with Jane Collier, who's on the front line of healthcare. She's been a district nurse for 30 years and carries out medical procedures that used to mean a long stay in hospital.
I thoroughly enjoy it. I have the best job in the NHS. I am a guest in patients' houses and we care as well as cure for them. So it's always a pleasure to see people in their own environment.
But what issues does Jane face every day? How is the health of our nation? One person who's in a unique position to know is the Director of Health Improvement for Public Health Wales.
Well, I suppose there's some positive news in the sense that the people of Wales on the whole are living longer and living healthier lives than they have done at any point in the past. But we're also aware of the fact that we've got some quite significant challenges. Things like heart diseases, stroke, cancers. There are also concerns about things like respiratory diseases, all of which can be prevented if we can act early.
These are the problems facing our district nurse Jane when she's out and about every day.
Yeah, services are stretched. We are the unseen army out here. We don't have a closure system. We don't say, well, sorry, our ward's closed, we've got no more beds. More and more referrals are coming in all the time.
Today, the first patient is John Smollett, a diabetic with a serious foot ulcer.
Hi John, it's Jane, the nurse. You okay today? Yeah. All right to come up? Yeah. Okay, John, how are you this morning?
Morning, Jane, how are you this morning?
All right. So is it all right if we carry on with your dressing
no problem.
and everything like that?
Along with Jane, John's wife Faye prepares for the treatment on his foot to begin. By working together, John can stay at home rather than in hospital.
His wife's most important to us because she has to hand me all the stuff and assist me with unclamping and clamping the machine. We come here, it could be 3 times a week, but John does go to the hospital on a Friday where they also check it and keep an eye on it. So it's alternate days. This is the tricky bit because we've got to try and get our phone to stay where it is. So if John can just lift his foot slightly for us. The foam is there ready. This is where we hold our breath. It gets all connected up. Once it's switched on, it'll count down and the vacuum will come on. There we are. The vacuum has gone in.
So that's working on your foot.
That's working on it, drawing all the bad out. What they are trying to do, they're doing this to stop them amputating below the knee, which we hope we haven't got to do. Well, they're trying to save my leg, they are.
So what are your hopes then for the health service in the future, for the sort of treatment that you and others in Wales will get?
Well, all I hope that they can help the people, they can stop at home, so people can have home care rather than go in hospital.
Registered nurses in Wales are worried about the future. While their workload is increasing year on year, their numbers are not. This is a concern for nurses working in hospital and in the community.
We currently have about 24,500 whole-time equivalent. That means nurses who work the 37.5 hour for the whole of Wales. And one of our next key issues that we're going to be campaigning for with the next Welsh Assembly government is that nurses need time to care. Many nurses in a recent survey from RCN Wales demonstrated that they work between 6 to 7.5 hours unpaid work across the NHS in all 4 countries in order to meet the healthcare needs of the population it serves. That simply is not good enough.
And that's coming on lovely. It's okay, Jim? Is that comfortable?
Yeah, fine.
Easy as that.
Concerns are that we've got to have a sustained increase in the number of nurses working in the community. It's not good enough to say that you don't need sufficient district nurses working in the community, that anybody can make that transition from the acute care sector into the community. That's just not the case.
District nurses like Jane often look after a patient's social as well as healthcare needs. That's the case with the 80-year-old patient who lives here in Gwent.
The home is old, as you can see. There are problems with the homes. We have to liaise with housing and social services to try and get her rehoused. She will be very upset about leaving the property, but obviously we don't want her health to deteriorate any further. And, oh, Jean, nurse.
Hello.
We have to come out here every week and take some bloods from her, and they go straight off to the path lab where then they are checked. Jean is frail, elderly. She can't, like I said, due to the isolation, she cannot get to surgery. So we come here. Okay, Jean, when I was here last, we talked about your housing. Have you made any...
I've got the forms to fill in.
Yeah.
And, you know, they'd like a doctor's note to say that I need accommodation.
We can sort that out for you. We'll arrange for the doctor to fill out all the forms for you so that you'll be top of the list then.
Jane delivers the kind of healthcare often called a prevention service that all of the political parties in Wales see as important. They want people to be happy and healthy in their own homes for as long as possible. It's better for their well-being, and in the long term, it's cheaper for the NHS. But with budget cuts, how can that service happen? What does the future hold for nurses like Jane? Nurses aren't the only group clamouring to be heard in the run-up to the election. A group of cancer charities have been lobbying at the Senedd. Cancer care is in the manifestos of all the main political parties.
Over the next 20 years, an estimated 7% of our population, some 200,000 people, will be living with and beyond cancer. We've got to prepare for that future, because if we don't, then the systems of today probably won't cope.
Among those campaigning is Keith Cass, who was diagnosed with prostate cancer 5 years ago. It came as a shock to this successful businessman who'd retired early to enjoy the luxuries of life.
This was the beginning of my life, wearing shorts all year round, going on holidays just whenever I chose to go on holidays. And things were going along swimmingly well. You know, I was keeping myself fit, I was doing all the running, I was a football referee, I was still playing a lot of squash, and keeping myself really fit and feeling good about myself as well.
Keith went for a health check and took a PSA test, the blood test which can indicate the presence of prostate cancer. Thinking nothing of it, he then went away for the weekend.
By the time I got back, My GP had already booked me in to see a consultant. And when I went to see the consultant, he made the observation that my PSA level, which is a simple blood test that costs less than £5, was at 125 instead of being between 0 and 4, maximum 6 anyway, which indicated that further investigations needed to be done.
Keith was on his so-called cancer journey, one that thousands of people in Wales begin every year. Many involved in cancer care believe that journey could be a lot more focused and fair.
As most of you will know, the Wales Cancer Alliance was established in 2006 and includes 9 major cancer charities working in Wales. Well, for us, there is one simple and important reason why Wales needs a comprehensive and person-centred cancer strategy, and that is to improve patient care and to ensure that Wales continues to invest in and prioritise cancer research and cancer prevention. We want a policy for the future that gives equal access to everybody. Doesn't matter where you are, we want the best possible treatment, the best possible care for everyone.
For Keith, inequality is stark. While prostate cancer is the most common form of the disease in men, it gets a fraction of the recognition of, say, breast cancer.
The women get their mammograms, the women get their cervical smears, and they get invited in to have these types of health checks. There is no such system for bringing that in for men.
We're introducing new programmes at the moment. The bowel screening programme has been introduced in recent years. There's a new programme starting to do with aortic aneurysm screening. So we are bringing new screening programmes into play all the time, but we do have to look very closely to make sure that the benefits outweigh the risks.
We need to have more patient power. I think we rely too much on politicians actually making decisions for patients.
For Keith, the fight with cancer goes on. He came off drugs for a year as his condition had stabilised, but has recently started treatment again.
Exercise is a big part of my life. I've got a cycle and a treadmill, so I use them when I feel I can. I've changed my diet quite a bit as well. I eat a lot of greens now. I steam a lot of my vegetables. I love fish, and I try to limit my intake of wine, but when you've got the neighbours I've got, sometimes it's a little bit difficult, but that's just party times. But I try not to go over the top about anything.